How you guys doing? Dr. Bill here with Thompson Healthcare Physical Therapy at our Lacey office, and today we're going to talk about hip strength. So we have three glute muscles, the glute max, the glute med, and the glute min. Today we're going to focus on the glute max and the glute med. Their job is primarily to extend the hip and also to rotate it laterally or externally. But a bigger thing that they do is they actually stabilize the hip joint and keep the pelvis level when you do things like walking or any sort of single limb activity. They're also very important with squatting, bridging, deadlifting, and a lot of things that you're going to do functionally at the gym. So we're going to talk about different things to strengthen them and keep the hips stable, and not just the hip, but also the lower back healthy. Okay, we're here with Dr. Steph, who's going to be our patient for the day. First thing we're going to talk about is bridges. Bridges is a nice way to get all of those glute muscles working. So the first thing we're going to do, if you remember back to our lower back exercises and our abdominal exercises, is we're going to do what's called a dead bug back. So I want her to flatten her lower back down. And then number two is she's going to squeeze her butt. And then number three, she's going to keep that lower back flat as she picks her hips up off the floor. Perfect. So now what you'll notice, go ahead back down. What you'll notice, if she doesn't keep that lower back flat, you'll see how much higher she can get. Go ahead. Perfect. So what she's doing here, she's actually using her lower back muscles to complete the motion. Come on back down. So when she keeps her lower back flat and she gets to the top, go ahead. What she should feel, and what you should feel, is you should feel a little bit of resistance through the top of the thigh, a little bit of stretching, as well as the glutes squeezing and contracting really hard. Come on back down. And then the last thing we'll talk about is how far the feet are positioned from your body. The further out your feet are, the more the hamstrings are going to work, and you might actually get a little bit of a cramp with it. So if you're noticing that happening, bring your feet a little bit closer to your butt, and then try again, and that should put that focus back on the glutes and off of the hamstrings. Also, if you're on a slippery surface, that could be another reason why the hamstrings cramp just a little bit. Okay, so the next thing is going to be a progression on that glute bridge. So what we're going to do is we're actually going to elevate her back now. So when you do this, you can do this on a stability ball, you can do this on a workout bench, it doesn't matter where you do it. But what you want is you want your shoulders and your head to be able to rest comfortably, and then the motion is basically the same. So go ahead down for me, and what you're going to do is you're going to squeeze, get that dead bug back, that's right, push through the heels to come straight up. Perfect, and you'll see how flat she is here. Again, if she didn't keep that back nice and flat, she'd get much higher. And again, those lower back muscles will be what's working. But go ahead, let's do one more right. Perfect. And what you're going to see is her feet are directly under her knees, so we don't want them too far out, we don't want them too far in. And again, she might feel just that little bit of resistance through the top of the thigh there where you might be a little bit tight in those hip flexors. And then you can actually work to load this up with plenty of weight, really as much as you want. But again, the focus has to be on the glutes squeezing and the glutes doing all of the work. Okay, so the next thing we're going to talk about are clamshells. Clamshells is a really nice way to isolate the glute medius, which is basically the muscle right here on the side of your hip. And that's the one that's going to stop your pelvis from dropping when you stand on one foot or go in anything in a single limb stance. So what we're going to do here is we're going to make sure that the hip bone is pointed directly up to the ceiling. You don't want to roll back or you're not going to be using that glute muscle as much. So you want to be pointed directly to the ceiling, and you want the knees to be about 15 to 30 degrees from the body here. And then normally what I'll do is I'll take that top hand and I'll rest it right on the side of the hip so that the thumb is on the glute muscle you're trying to work and your fingers are on your hip flexors that we're not trying to work. What you're going to do here is you're going to keep your feet together. Again, don't let the hips roll back, and you're just going to pick the top knee off the bottom knee. Perfect. And then typically you hold there about 2 seconds. And back down, and anywhere from 10 to 15 reps for 2 to 3 sets. You can also do this for endurance and hold for about 30 seconds and try 3 sets of 30 seconds with about 15 to 30 seconds in between each. Now we're going to work the glute medius in a more functional way by focusing on single limb stance. So what we're going to do is we're going to stand on one foot with the opposite knee up to 90 degrees. Perfect. And then what we're going to do is we're actually going to push as much as we can through that foot that's standing to get as tall as possible. What you should feel is you should feel your glute muscle, your butt muscle click on right there as you do it. Typically what we do is we try to hold for about 30 seconds and do 3 repetitions. Once that gets easy, you can start working on unstable surfaces like standing on a pillow at home, or if you have something called an RX pad, which just makes it a little bit harder. So the next exercise we're going to focus on is going to be called side steps. So typically we start with the band around the ankles. If you have any knee issues or if it hurts, you can always try with the band around the knees. But first thing we're going to do is we're going to get a mini squat position, which is really just hips back and then the knees bent. Whereas a lot of times people will actually just do a position where they just bring their knees forward, which will focus the exercise more on their quads. So again, it's just kind of like a little booty pop is what we're looking for. Hips back just ever so slightly. And then she's going to keep her toes pointed forward the whole time. She's going to go from her hips about shoulder width to wider than shoulder width, and then back to shoulder width again. The goal is to never let the tension run out on the band. And then we're going to step, 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 step. The goal is to get 10 steps down, 10 steps back, and to get at least 3 laps, with the sweet spot really being around 5. So those are some nice rudimentary exercises just to get the glutes a little bit stronger and the hips a little bit more stable. They're also nice to use really as warm-up to a workout routine involving squats, deadlifts, just to get the glutes firing better so that they work a little bit more efficiently when you're doing your main lifts. I'm Dr. Bill. Thanks for stopping by at Thompson Healthcare and Sports Medicine.